Hi. It's a pleasure to be here today to talk about who are the women giving birth in various settings. And I'd like to acknowledge my co-authors, Jean DeClercq and TJ Matthews. Now I'm going to figure out how to advance the slides. Is it the arrow? Okay. Okay, good. Um, Data in this presentation are based on all birth certificates filed in the United States each year. These data show the number of births that were actually delivered in each location, whether a home, a birthing center, hospital, or elsewhere. Unfortunately, the data cannot identify women who originally planned to deliver at home but were transported to a hospital due to complications. As you know, there have been large changes in birthing patterns in the U.S. over the past century. In 1900, almost all U.S. births occurred outside a hospital, the vast majority of which occurred at home. By 1940, only 44% of U.S. births occurred outside a hospital, and by 1969, only 1% occurred outside of a hospital. The percent of out-of-hospital births has remained around 1% for several decades. The 1989 revision of the U.S. Standard Birth Certificate allowed us to distinguish for the first time between types of out-of-hospital births, such as home and birthing center births. In 1990, there were nearly 47,000 out-of-hospital births in the U.S. This number declined gradually to a low of about 35,500 in 2004. However, out-of-hospital births have increased by 36% since 2004. In 2010, just over 47,000 U.S. babies were born outside a hospital, representing 1.2% of U.S. births. This is a substantial increase, but out-of-hospital births are still a drop in the bucket compared to the nearly 4 million in-hospital births in the United States each year. Among out-of-hospital births, about 2/3 are home births. 28% take place in a birthing center, and 5% are identified as other. We don't really know what that means. Okay. This slide shows the number and percent of home and birthing center births in the U.S. from 1990 to 2010. As with total out-of-hospital births, both home and birthing center births declined gradually from 1990 to 2004 and then increased rapidly from 2004 to 2010. Home births increased by 41% from 2004 to 2010, with 10% of that increase occurring in the last year. Birthing center births increased by 44% from 2004 to 2010, with 14% of the increase in the last year. In 2010, there were 31,500 home births and 13,166 birthing center births in the United States. This is what the birth certificate data shows as far as who is delivering the out-of-hospital births. 29% by certified nurse midwives or certified midwives. 41% by other midwives, which include certified professional midwives, licensed midwives, or direct entry midwives. A small number are delivered by physicians, which may be mostly in emergency situations, and I'll talk more about this in a minute. Surprisingly, for nearly a fourth of out-of-hospital births, the care provider is listed as other. This category pertains mostly to home births and could include an emergency responder, for example, as well as cases where the father or another family member signs the birth certificate. The overall trends in out-of-hospital birth disguise large differences by race and ethnicity. Even from 1990 to 2004, when overall out-of-hospital births were declining, out-of-hospital births for non-Hispanic white women increased by 5%. Out-of-hospital births for all other race and ethnic groups declined during that period. In the more recent period, from 2004 to 2010, out-of-hospital births increased by 46% for non-Hispanic white women, from 1.2% to 1.75% of births. So in 2010, for non-Hispanic white women, 1 out of every 57 births in the U.S. was an out-of-hospital birth. From 2004 to 2010, out-of-hospital births increased more slowly for other race and ethnic groups, so that in 2010, the percent of out-of-hospital births was 3 to 4 times higher for non-Hispanic white women than for other race and ethnic groups. In fact, about 90% of the total increase in out-of-hospital births from 2004 to 2010 was due to the increase for non-Hispanic white women. We know that only low-risk women should deliver outside of a hospital, but the precise definition of low risk remains controversial. The next group of slides looks at the distribution of home, birth center, and hospital births by characteristics and risk factors to better describe the risk status of these births. For example, about 9% of hospital births are to teen mothers, compared to 2 to 3% of home and birth center births. At the other end of the age spectrum, about 14% of hospital births are to mothers aged 35 and older, compared to 15% of birth center and 21% of home births. Women having a home or birth center birth are less likely to be having their first birth and are more likely to have had 3 or more previous children. Two to 3% of women with an out-of-hospital birth smoked during pregnancy, compared to 9% for hospital births. 14 to 15% of women with an out-of-hospital birth were unmarried, compared to 41% of women with a hospital birth. Women with a home or birth center birth are much less likely to deliver preterm or have a low birth weight infant. And they are also much less likely to have a multiple pregnancy. The prevalence of diabetes and hypertension was also much lower among women delivering at home or in a birth center than among women delivering in a hospital. The lower rates of medical risk factor for out-of-hospital births suggest that appropriate risk selection of low-risk women as candidates for out-of-hospital births is occurring. Although, there could possibly be some differences in reporting of risk factors between out-of-hospital and hospital settings. That can't be ruled out, but we have no evidence of that. Let's see. Another interesting comparison is to look at changes in the risk profile of home and birthing center births over time. This slide shows differences in selected risk factors for home births between 2004 and 2010. The percent of home births to both teen and older mothers declined from 2004 to 2010. The percent of home births to unmarried women, or those with a live birth order of 4 or more, also declined during this period. The percent of birth center births with these risk factors also declined substantially from 2004 to 2010. The percent of home births that were born preterm or at low birth weight also declined substantially from 2004 to 2010, while there was little change for multiple births. There was also a decline in the percent of birth center births that were born preterm, and little change in the percent of low birth weight or multiple births. These declines taken together suggest improvements from 2004 to 2010 in the selection of low-risk women as candidates for home and birthing center births. Unfortunately, changes in reporting of some items such as smoking between the 1989 and 2003 revisions of the birth certificate mean that we can't get a clear trend for those items. Another important indicator of risk for home births is the planning status of the birth. Studies suggest that most home births are planned home births, whereas others are unplanned due to an emergency situation or when a woman couldn't get to the hospital in time. Unplanned home births may be at higher risk for poor outcomes, with the birth taking place in an environment unprepared for a delivery. In 2010, 31 states and DC, representing 60% of U.S. births, provided data on the planning status of home births. Data from these states are not completely representative of the U.S. population, but they can suggest national trends. In 2010, 88% of home births were planned and 12% were unplanned. However, this percentage varied greatly by care provider. For physicians, very few home births were planned, which is in keeping with the preference of most physicians to attend births at hospital. In contrast, 98 to 99% of home births delivered by midwives were planned. Surprisingly, more than 2/3 of the home births in the other category were reported to be planned home births. This seems to suggest either that some women are planning to deliver at home without a trained care provider, or more likely that the father might sign the birth certificate in states where some types of midwives may not be licensed, or a bit of both reasons. The planning status of home birth also varies considerably by the race and ethnicity of the mother. Among non-Hispanic white women, 93% of home births were planned in 2010. However, for non-Hispanic Black women, only 1/3 of the home births were planned and 2/3 were unplanned, which suggests that home birth is not a popular choice for most non-Hispanic Black women. For Hispanic and Native American women, about 2/3 of home births were planned, and for Asian and Pacific Islander women, 3/4 were planned. Now let's look at differences by state. The percent of home births was generally higher in the Pacific Northwest and lowest in the South. In 2010, for Oregon, Montana, and Vermont, more than 2% of their total births occurred at home. 7 additional states had between 1.5 and 2% of their births occur at home: Alaska, Idaho, Maine, Pennsylvania, Utah, Washington, and Wisconsin. For 16 states, at least 1% of births were home births. As I mentioned before, the percent of home births in the U.S. increased by 41% from 2004 to 2010. Let's see how this increase played out at the state level. This map shows the percent change in home births for each state from 2004 to 2010. States with no statistically significant change are shown in white. States with an increase in the percentage of home birth are shown in blue. The light blue shows an increase less than the national average of 41%. The dark blue, an increase of 41% or more. Overall, 35 states had statistically significant increases, including 19 states where the percent of home births increased by 41% or more. The increase from 2004 to 2010 was widespread and involved states from every region of the country. Only Vermont, shown in red, had a significant decline in the percent of home births. Even after this small decline, Vermont was one of the highest states for home birth, with 2% of Vermont babies born at home in 2010. Data was not available for Ohio for 2004 due to a data processing problem, so we couldn't compute a percent change for that state. This slide shows the percent of birth center births by state. The percent of birth center births was highest in Alaska at 4.4% and in Idaho at 2.1%. 4 additional states, Montana, Oregon, Pennsylvania, and Washington, had 1% or more of their births in a birth center. In contrast, for 23 states, the percent of birth center births was less than 0.1%. Part of the variation between states is due to geographic differences in access to birth centers. As of January 2013, 13 states did not have a freestanding birth center listed with the American Association of Birth Centers. 6 states had increases of 300 or more births in a birth center from 2004 to 2010: Florida, Oregon, Pennsylvania, South Carolina, Texas, and Washington. Together, these states accounted for more than 3/4 of the U.S. increase in birth center births during this period. In summary, after a gradual decline from 1990 to 2004, the percent of total out-of-hospital, home, and birthing center births increased rapidly from 2004 to 2010. The increase was widespread and involved states from every region of the country. In 2010, 1.2% of U.S. births were out-of-hospital births. About 90% of the increase in out-of-hospital births from 2004 to 2010 was due to increases for non-Hispanic white women. And in 2010, 1 in 57 births to non-Hispanic white women were out-of-hospital births. In 2010, 88% of home births were planned. For non-Hispanic white women, 93% were planned. Out-of-hospital births were most common, 2.5% or more, in Alaska, Idaho, Montana, Oregon, Pennsylvania, and Washington, and least common in the South. Home and birthing center births have a lower risk profile than hospital births, and with fewer births to teenagers or unmarried women, and with fewer preterm, low birth weight, and multiple births. Women giving birth out of hospital are less likely to be smokers and less likely to have diabetes or high blood pressure. Conversely, there was a higher proportion of out-of-hospital than hospital births to older mothers and to those having a fourth or higher order birth. The risk profile of out-of-hospital births for most of these characteristics improved from 2004 to 2010, suggesting that appropriate risk selection of low-risk women as candidates for out-of-hospital births is occurring and improving. And here's my contact information as well as a link to a recent report that we've done on home births. And there's another article forthcoming. Thank you.
Thank you. So those two talks were now going to be followed by a discussant who's Dr. Nigel Paneth, who's from the Michigan State University, is a pediatrician and a perinatal child health epidemiologist with a particular interest in causes and prevention of childhood neurodevelopmental setbacks. Just to give you a little bit of his background, he was on the original panel that was held here in 1982 on the same topic. And he has conducted or led studies, one which is the AHRQ study, which was an international study of low birth weight outcomes. He currently heads the Michigan Alliance of the National Children's Study, and has written many papers and chapters on this topic. So Dr. Paneth.